Hello, Dr. Ida. In case a person is diagnosed with IBD, that is either Crohn's or the ulcerative colitis, is it a misconception that people think that food and this particular disease don't go hand in hand? They have to avoid certain foods, or some foods flare up the condition. Is it true?
Yeah, I mean that's the problem. I think it's very natural to always associate diarrhea, someone with abdominal pain with food, the reality is, yes, of course, patients, many of my patients will tell me that there are some foods that they cannot take which are more likely to flare up their IBD than others. But if you actually look at the data, they've actually never found a specific food type that can actually everyone with inflammatory bowel disease should avoid. And that's the whole point. So I think it's all very individualized. And I think what often happens is that a lot of these patients avoid a lot of foods, which, such as gluten, dairy products. Now again, dairy products in particular, I think if your disease is well controlled, then there's no reason why you shouldn't have dairy products, because it's rich in calcium, it's a good source of protein, and so on and so forth. But a lot of patients with IBD avoid it because they think that they would be able to avoid the flares by not taking a lot of foods, and this can be a problem because they already might be malnourished, they might be very thin, and then on top of that they put themselves on a very restrictive diet, so it can actually be counterproductive. But as I said before, the truth is probably in between. I think probably for each individual there are some foods that can trigger their IBD.
Right.
It's not it's not so clear at the moment. We have no data to actually show which specific food that we can recommend for all patients to avoid or anything like that.
So can I say that it's more like a multidisciplinary kind of a treatment that a person with IBD gets, wherein a nutritionist also is involved?
I think I would always involve a dietitian if possible for my patients with inflammatory bowel disease, especially for Crohn's disease, maybe less so for ulcerative colitis, because I think it always helps to have good balanced nutrition.
True.
It always helps to avoid the bad foods that we all know, and there are some, so there are some types of Crohn's disease, for example, where the bowel is narrowed. So in those cases, maybe they also have to be a bit mindful of certain foods which can cause blockage or predispose to blockage. So and also I think it always helps to involve a dietitian more for their own knowledge and for their own for them to feel better, because otherwise I think they get very nervous, they get very scared, they don't know what to eat and what not to eat. So I think to have a dietitian who can advise on all this is very important.
Ulcerative colitis and Crohn's disease, both of them come under this IBD. So does having one can lead to the other?
The way I see it, I think it's a spectrum of diseases, which is basically an autoimmune condition. Autoimmune because something in our immune system has gone wrong, be it due to genetics or in something in the environment. People have linked things like childhood antibiotics, for example, as one possibility, or so something has caused our immune system to just keep attacking the bowel.
Right.
And I think that's what inflammatory bowel disease is. And ulcerative colitis predominantly affects the colon, whereas Crohn's disease can affect anywhere actually. But the reality is it may not be as simple as that. So for example, if you've got Crohn's disease of the colon, they can look very similar to ulcerative colitis. So the answer to that is no, I won't say that one leads to the other, but sometimes the diagnosis changes because at first the physician is not so sure, because sometimes it can be very difficult to actually categorize it into either Crohn's disease or ulcerative colitis, if you like. So I think that's the thing. And if we're really not sure, there is a term called IBDU, IB, inflammatory bowel disease unclassified. I think ulcerative colitis. So a lot of physicians who perhaps are less aware of the colonic features of Crohn's versus ulcerative colitis, generally in Malaysia, for example, and I suppose in many parts of India as well, they will diagnose anyone with IBD of the colon as ulcerative colitis. But then they might come to a tertiary center and then they say, oh no, actually this is not ulcerative colitis, it's more likely to be Crohn's disease, and it does cause quite a bit of confusion. And the truth is, does it really matter? In most cases, I will have to say probably not, because the treatment is more or less the same. Not completely the same, but more or less the same. Yeah.
Thank you so much, Ida.
Okay, all right.
Thank you.
Okay.